Surgical treatment of spasticity, intrathecal baclofen pump implantation under subarachnoid block. This patient is a 43-year-old woman who was diagnosed with multiple sclerosis at the age of 22 years old. In January, the patient was admitted to the hospital with clinical signs of spastic tetraparesis with a greater involvement of lower limbs. Patient was tested with 50 micrograms intrathecal baclofen infusion by lumbar puncture and showed improvement over Ashworth score and Penn score. Thus, she underwent surgery for a baclofen programmable pump implantation. 1 hour before the operation starts, we administer 1 gram of intravenous vancomycin as antibiotic prophylaxis. In the surgical theater, the patient is positioned on lateral decubitus and spinal anesthesia is performed. The patient is positioned supine while wearing anesthetic to be effective. We thoroughly position again the patient in a right lateral decubitus. We carefully disinfect the skin with the chlorhexidine gluconate and prepare the surgical field, paying attention to leave uncovered the back, the left side, and the homolateral paraumbilical region. Before the skin incision, we identify the right interlaminar L3, L4 and L4, L5 space by touching the spinous processes of L3, L4, L5. We mark them and we perform local anesthesia before skin incision over the midline. We open the cutaneous and subcutaneous layers in order to expose the lumbar fascia. We position the 15-gauge 2OI needle through the L4, L5 interlaminar space, making sure that the CSF comes out, and we push forward the spinal catheter in the subdural space for about 20 centimeters. It is essential to fill the entire system of catheters with physiological solution in order to remove the air, thereby preventing their obstruction. After removing the stylet of the catheter and checking again the outflow of the CSF, we anchor the spinal drainage to the muscular fascia using the specific fixation wing in order to avoid catheter dislocation and at the same time paying attention not to close the system. The preparation of a new pump includes 3 main phases. The first one consists of inserting the needle of an empty 50 ml syringe into the reservoir fill port in order to extract a predetermined volume of the fluid containing the device. It is essential not to remove the needle before the air bubbles start coming out in the syringe. The second one consists of filling the empty pump with a 50 ml syringe containing 40 ml of baclofen drug. The last key step, which can only be done with the programmable pumps, is the calibration and adjustment of the releasing dose, rate and timing parameters of the pump using an external programmer. The surgeon incises the cutaneous and subcutaneous layers of the left paraumbilical region until the superficial muscular fascia is exposed. A new small skin incision is made on the side in order to allow the passage of the extension catheter with a trocar. The extension catheter is double tunneled under the skin. The first step consists of pushing the trocar from the side incision toward the abdominal pocket. The second one of passing the catheter from the side towards the back. Now the catheter connector, part of the extension system, can be inserted inside the spinal catheter and tied with a knot of unabsorbable suture. After the connection of the extension catheter to the catheter port of the pump, the whole system is ready and the pump is placed inside the abdominal pocket. On the sides of the pump, several suture loops are used to secure it to the abdominal fascia. We always try to leave an appropriate subcutaneous layer enclosing the skin and to release possible tension in order to prevent skin erosion and decubitus. It's essential to close very carefully the subcutaneous and cutaneous layer in order to prevent infections and adhesions of the wounds. Usually, we remove stitches 2 weeks after surgery.